Yeah, so people might come across, I guess, a variety of prices for cosmetic and plastic surgery. It's important to realise the difference between surgeons that are accredited by the Royal Australasian College of Surgeons, so they have an FRACS, PLAST, behind their name, and those without those letters. So people that have an FRACS have undergone barrier exams, usually several of them, regular assessments that mean that there have been barriers to entry to that specialty. Unfortunately, the term surgeon can be used by anyone in New South Wales that is a doctor. They are working on trying to restrict that, but there are people calling themselves cosmetic practitioners with very little training beyond a medical degree, and also training that is not accredited by any government recognised bodies. It's also important to look very carefully at practitioners that are allowing procedures that most normal surgeons will do in a hospital under general anaesthesia in their rooms. Patients commonly seem to have the misconception that sedation is a safer option for certain procedures than is a general anaesthetic. People have to realise sedation, if it gets too deep and in an uncontrolled setting, it's like an uncontrolled general anaesthetic. You're essentially not able to breathe properly, but you don't have the safety of the anaesthetic equipment and a tube and an anaesthetist that's controlling your breathing. So it is a huge misconception that sedation surgery is safer. In fact, I certainly would not sign up to any of the procedures, more major procedures that I offer under a sedation. I'm a fairly tough person. But I think it's unsafe, and there have been cases where people have had to be rushed to hospital due to toxic doses of local anaesthetics that need to be used because they're not completely asleep. So when looking at price, a lot of people can be alarmed by the cost of the hospital, but you're paying for safety and an anaesthetist and proper post-operative care. So that may be sometimes when people are looking at cheaper surgery options, that cost cutting is actually also compromising their safety. As well, it's very disconcerting as a surgeon performing a procedure that starts to be painful in someone that is awake. And even more minimal amounts of liposuction, just for small amounts to fat graft, say the face, can be extremely uncomfortable. And in the end, that firstly compromises potentially the person's results and also makes the experience highly unpleasant. In terms of overseas surgery, look, there is a proportion of people, I don't want to criticise every overseas surgeon. There are accredited plastic surgeons in Thailand. I mean, we cannot simply compete with the running costs of their hospitals or the cost of their implants and other consumables. However, you also have to consider the risks of revision and long-term follow-up. What are you going to do if your procedure goes wrong? We try to have, in my practice at least, a reasonable revision policy that if anything goes wrong, you're not going to be up for all the costs of a brand new surgery as you risk doing if you travel overseas and don't get appropriate follow-up.